There's a relatively new condition related to Lyme disease that's been gaining attention in recent years that stems from a tick bite that creates a meat allergy. Yep, a meat allergy. This condition not only creates dietary restrictions, it also can present as severe dermatologic and gastrointestinal reactions, as well as emotional and neurological manifestations. Today, we're going to discuss a recent diagnosis of a 16-year-old female, as well as the treatment she received from our medical center, the New York Center for Innovative Medicine. This is the story of Alpha Gal case review with Nicole Ritieni. Nicole, so happy to have you back on, your second time on,
Yeah.
discussing a case this time. This is our first time doing case reviews. I was kind of excited for it. When we talk about this new type of condition, alpha gal, it seems like something only impossible meats would like create through tick and give you this but it's a really debilitating thing. Like,
Mhm.
I don't mean to jest about it. Can you talk about how this specific patient, a young girl, came in and what she was presenting when she came in? Did she already have a diagnosis?
So she was referred by a patient who also went through treatment with us for Lyme. So that was helpful for her. She did have a diagnosis of alpha gal, which they can typically find via blood tests. But she did not have a Lyme diagnosis, which is always
Mhm.
interesting and something we see a lot here, that someone's displaying a lot of hallmark symptoms of Lyme, which I wouldn't say alpha gal necessarily always is, but she did have all of the other ones we often see, like really bad anxiety, generalized muscle and joint pain, insomnia, night sweats. For someone her age and being very young, these things are pretty abnormal. So she was tested for Lyme, but it came back negative on her conventional tests. When she made it to us, she had been experiencing some of these symptoms for about 6 months, probably more of like the normal Lyme symptoms, like anxiety, joint pain, stuff like that, had been going on for some time. But the allergy or issues with meat were probably about 6 months by the time she came to us. And what would happen in her case is if she ate any meat, like specifically beef, pork, lamb, those type of things, she would start getting almost like a poison ivy type reaction, is how you could imagine it. It would go all over her face, different areas of her body. It could be different each time. The interesting part for her that made it, I think, even more challenging was even if she smelled the scent of someone around her having meat, she would have similar reactions. She would get a lot of abdominal pain, also described kind of like as if a really tight band was placed around her torso and squeezing her. So this was happening to her for about 6 months, and there wasn't really much treatment she was being offered. It was kind of like ride it out and just avoid eating and being around all these meats, which is basically impossible because, then it starts impacting your social life. So this is a good case of reminding us that it's not always just the physical implications, but how socially it affects the whole patient and their whole life.
And their family and everything. I mean, this patient, I believe, was from Texas, correct?
Mm-hmm.
Like the home of barbecue and and all that.
Yeah.
Like, obviously that's a big part of family get-togethers. And you're telling me the conventional approach that you heard probably from the patient, from the parents and everything was just ride it out.
Yeah, she wasn't really, she did the antibiotics,
Hmm.
just to kind of rule out anything because she had been bit by ticks in the past, but it didn't necessarily help her. It was more so, I think, to appease her than them
Yeah.
really finding a solution for the problem because they didn't diagnose her with Lyme. But yeah, she wasn't really given much to work with. I mean, fortunately, she had known someone that came to us and had a lot of success with their own condition, although he did not experience alpha gal syndrome. Um, but yeah, that was kind of her whole story, coming in and just looking to live a normal life again, be able to eat meat, be around meat, as well as all the other symptoms were debilitating for her too. But this was like her last straw.
Oh, absolutely. That's got to cause some emotional damage as well to the patient, not knowing if you'll ever live a normal life, because meat is all around us as much as you
Yeah.
try and avoid it. If she's going to have that reaction, just the scent of it being around it, everything changes drastically in this life. So finding
Yeah.
solutions is very big for someone going through that. Fortunately, she did find the solutions. When evaluating this patient, when they came in and, finding these things, the co-infections, everything, was there anything that stuck out to you that would be different than the pattern of what you see in most Lyme patients, or was it very similar?
It was pretty similar.
Was.
I will say something for her that we found that might be different is issues with allergies and the way her immune system was recognizing meat. Specifically for her, it was actually grains because, all animals are eating grains essentially.
Yes.
So we worked on allergy elimination for grains for her. And I think it was the whole approach and the whole picture that ended up helping her, but that was what was pretty different from her and other Lyme patients.
Interesting. And that was, did you guys go about NAET for the allergy elimination within the comprehensive program of treatment that was added in?
Yeah, through starting during detoxification for her because it was also creating a blockage within this patient's nervous system. So
Mm.
when we do identify allergies with patients, we often detoxify them first and then address
Mhm.
it after. But for us within detoxification, we're also trying to regulate the nervous system. So we would struggle to do that if we weren't then working on the allergy of this patient. So she had 3 sessions of, NAET just to work on grains. And that's all she ended up needing for that, which is relatively easy when you think about what she might have gone through for who knows how long. But yeah, that was a major difference for her. And I do believe a big help in her, being able to return to normal eating patterns.
I know for most Lyme patients, and you could talk about this specific case with the alpha gal, of course, everything's personalized and tailored, but you have these patterns that go along with it. And the pattern, as you mentioned, starts with this detoxification, improving of the terrain so that
Mhm.
it's easier to go after any microbe or pathogen there. And then you go into this antimicrobial phase where you're trying to target all co-infections in different ways. And then finally, a regeneration, emotional energy balancing, all the extra pieces at the end. Did you see the same patterns in this case with the alpha gal associated with Lyme?
Yeah, she did. Aside from the allergy elimination, I would say it was pretty on par with the rest of the Lyme patients we've treated here. They always have some, it's personalized, so they do have variations within, what type of compounds we're putting in their IV bags, where are we working on their nervous system regulation, where are we finding disturbance fields on this patient, and then, their supplement protocol as well is very much tailored to the patient. But she did follow a pretty, for lack of a better word, normal course for our Lyme patients here.
I'm curious because you have a young patient that was, I understand, relatively healthy prior to this tick bite, correct?
Mhm.
Prior
Yeah.
to the alpha gal diagnosis and the Lyme association. What was the level of toxicity? Because that's always a really interesting piece there. We do it a little bit differently than, let's say, urine provocation or anything. We're
Mhm.
looking interstitial using Dr. Schimmel's biological index on a scale of 1 to 21, 1 being incredibly clean terrain, 21 being pretty, nasty and very, very toxic terrain. What was she at?
So she was high, especially for her age. She was at a 16.
Okay.
When a patient starts entering that like 13 to 16 range, it's showing us they definitely have a very high amount of inflammation now going on in the
Hmm.
body. So it's probably been happening for a certain amount of time, not like a relatively recent issue. And she was on the borderline. So when they start crossing over 17 to 21, they're starting to enter a degenerative type of process. And that's when you're looking at a lot of the more scary type of diagnosis. So she was right there. I think she came at a really good time because it was relatively easy to treat her with everything she had going on, but she was definitely progressing into more of a severe place in her health.
Yeah, no, we definitely got there at the right time. So it didn't go into those very high levels where it starts to really do damage throughout the body that could be lasting in some ways and require more regeneration afterwards. How long was the treatment and the phases within it? Sometimes it's a 4-week detox, sometimes it's this. Again, realizing these are not protocols or anything, but
Yeah.
her individual treatment plan. What was the length of hers and what it looked like in the phases?
Since she was traveling in, she was getting
Hmm.
daily treatment, so it did make it a little bit quicker for her. All in all, she was here for 4 weeks.
Okay.
So she had 2 weeks of detoxification and then 2 weeks with our antimicrobial treatments. This patient ended up, opting out of the regenerative phase of treatment. She was just unable to stay. However, she still did the bulk of her treatment and did really well. She had a quick turnaround, I would say, from other patients I've seen here, but while she was here, the important part of, I think, her success is she truly did everything.
Hmm.
She from the physical treatments all the way to the emotional treatments and really embraced it. So her compliance to everything, I think, is what allowed this quick turnaround.
And at day zero, I understand she couldn't even be in the same room as anything with meat, and that would be already too much. Where was she at week 4, day 28?
So this patient started like feeling better with a lot of her other symptoms I mentioned in the beginning, like as soon as she started detoxifying, which we do not always see. Sometimes people get a little bit worse before they get
Yeah.
better, but she was someone who started, I think, just with her age, how young she is and otherwise healthy, as we started removing that toxic load, it's like a lifting a weight off the patient's shoulders. At the end of her treatment, ideally she probably would have consulted with us before eating any meat, but she just went for it and had a burger one weekend
That's
and
a
came.
good sign if she's like, hey, I want a burger. I'm gonna try this out.
She
Like, all
just
right.
went for it. But she ended up coming into, maybe this was after her first week of antimicrobials. I don't believe she even finished the full thing because she came back in and we were able to talk with her about this. And she said she was fine. She had no reaction at all. And then she finished her last 2 antimicrobials. And to my knowledge, went on and has been able to be okay. This patient also, her family has a farm and they do a lot of work on their farm. So even being around the animals on the farm,
Mm.
which was a huge part of her life between the work her family did, and she just loved her animals. She couldn't even do that. So as time went on, there was just in more ways, anything to do almost with animals created this reaction in her. And that also improved as well.
No, it's incredible that within those 4 weeks and going through the patterns that, she ended up in a state like that. Were there any particular therapies that you could say, you would attribute to a greater improvement for her understanding, synergy, personalization, comprehensive nature? It's not
Mm,
that, hey, we did this one thing and that was it. She jumped in,
yeah.
that was there anything that you felt or even that maybe she exhibited and told you that, wow, I really started to feel different afterwards?
For her, I mean, one could say it's the antimicrobials, right?
Yeah.
Killing off the pathogens that are, but it is the comprehensive approach. So it's not like a black and white answer. Um,
Hmm.
but she did truly start feeling like herself again after maybe her first week of detoxifying. Toxicity is something that slowly happens to us over time. You don't always realize it. So you don't realize it's almost like this drop in the bucket of feeling worse and worse. It's not so loud, over that time that that's happening. But then when you start reversing that or remembering what you can feel like, it's like this aha moment for patients. And that happened to her pretty fast.
It seems like, regardless of an alpha gal diagnosis or a Lyme diagnosis, the idea and the approach that we espouse still stays the same. And that is one that truly provides a new terrain, cleansing of the terrain so that these things can't persist, and then really attacking each of the underlying dysfunction. Am I correct in that?
Yeah. I mean, at the end of the day, the body has its own great intelligence, and we want to just support and restore that. I would say all the treatments that we're doing here are just working with the patient's own body to optimize it again and make it do what it's always supposed to. Oftentimes, people come in with high toxicity, heavy metal toxicity, chronic or underlying infection, and that's inhibiting their body. Your body's confused and it loses the ability, it's burnt out and unable to do these normal functions. So in restoring that for these patients, by targeting specifically what's going on with them, their body then takes over and starts doing the job again. So I think that's the best part of seeing patients come to treatment here is they recognize, oh, my body can do this. Like I can take over again. And it's me, yes, we're helping and facilitating the treatment, but it's the patient that's doing all of this.
And it goes to show, even in the face of something new and kind of not yet known, like alpha gal, how many people have even heard of that? This idea of a meat allergy by tick. It's pretty novel and new, and yet the approach doesn't change. If you go against the underlying issues there, if you really try and, clean out the biological environment of a patient, you will see progress. And then you have all these tools that you can kind of pinpoint what they need within it. Was there anything in the treatment plan aside from the NAET that was maybe unique to her condition as opposed to others in this Lyme prism, if you were to group it, or is it again kind of like typical here?
I would say it's more typical because at
Yeah.
the end of the day, an allergy is usually some inappropriate response of the immune system. It's recognizing something as a threat when it's really not a threat. So we're trying to find, why is that happening? Where is the dysfunction coming from? From her, it was many things. She even had a very high degree of heavy metals,
Mm.
many things blocking her nervous system. She had 3 different issues blocking her nervous system. And that will cause, like, hijack the immune system essentially, and it's not able to do what it's supposed to. For some reason, hers identified meat as a threat. Obviously, to us, it's there's nothing threatening about eating meat, but her body identified it that way. So it's just restoring proper function of this patient's immune system with eradication of the Lyme and with the allergy elimination as well.
Yeah, a really fascinating case. And I'm glad you could present it. And I'm hoping we could do more of these as we go forward because we have a lot of these interesting cases. This one stuck out, and that's why I really wanted to get you on. I know you're busy and I don't want to take you away from patients. So thank you so much, Nicole, for coming on, sharing that case, and hopefully we'll see you on shortly.
Yeah, for sure. Thank you.
And as you heard, be sure to check out innovativemedicine.com, NYCIM.com as well. You could actually take a quiz that, if you kind of qualify through that, you could speak with our patient success manager. If you know someone with alpha gal, absolutely share this. I mean, this is where the hope kicks in. Imagine that girl was told that just stick it out and see, where
Mhm.
would she be now? So this is a
Yeah.
really, really good representation of what happens when you go at something with a different approach than a conventional and a different understanding of disease as together. So thank you again, Nicole.
Yeah. Thank
Until
you.
next time, keep writing
Yeah.
your own healing story.